Good evening and thank you so much for joining us. I'm Marcus Hunter. County and hospital leaders met today to hear the state of OCH Regional Medical Center. No information was released from the executive session where the report was given. However, supervisors did give some indications as to why they want to look at whether the county should stay in the healthcare business. Our Joey Barnes explains.
Within a matter of minutes, the Oktibbeha-County Supervisors closed a Monday morning meeting to the public. In executive session, they heard about the finances of OCH Regional Medical Center and other issues impacting the facility.
What we're hoping for is to get quality, to make sure we have quality health care here in Oktibbeha-County and a growing healthcare facility.
I guess the good thing about it is that we can rock on like we're rocking forever. And I think that there's no secret to some of the challenges and some of the threats, but there's also no secret, in my opinion, to some of the opportunities.
Some of those challenges are similar to what other hospitals have faced, from staffing issues to losing money and services. The Mississippi State Department of Health issued a clarification statement to WCBI on Monday afternoon, saying in part, the Level 3 trauma designation is currently suspended as set forth in the Mississippi Trauma Rules and Regulations. It previously told WCBI that OCH did not have a trauma designation. OCH is working to correct the issue. The hospital can provide basic trauma care to stabilize patients before transferring them to another facility. Some patients would not go to the hospital at all.
It is true that the hospital has had some struggles, difficulties from a financial standpoint, and those struggles are not sustainable.
With the right partner, we can do some really substantial and significant things in healthcare, because right now the county is not in a position to be the kind of partner that OCH Regional really needs in order for them to reach their potential.
The hospital has received some grant and Medicare funding. Supervisor and board president Marvell Howard says that is not a long-term solution or impact.
Which has allowed them to be able to continue to function a little bit. Those are some unknown factors, but those are factors that can't really be considered into the continued success of the hospital. So we'll have to go based on the history of the hospital.
County leaders say they want a hospital that is growing just as fast as the community to meet its needs. Oktibbeha County residents voted down a possible sale of the hospital nearly 7 years ago. It seems the political winds have moved, but the public will still get a voice.
Just have one public hearing for the public to be able to come and ask questions and receive as much information as they possibly can. Upon the end of that public meeting, then the board will decide whether they're going to vote to move forward with the sale or if we're going to do some sort of lease agreement.
We just see that there's a lot of potential, and perhaps a potential transaction. And so we're wanting to make sure we get all the information.
In Starkville, Joey Barnes, WCBI News.
And the public hearing on the resolution to sell the hospital will be on September 19th at the Oktibbeha-County Courthouse. It will begin at 5:30. Now, we are awaiting the release of a statement by an OCH spokesperson.